Hello, everyone. A very warm welcome to you. Before we begin, I have a few pointers for your kind attention. All attendees' mic will be muted by default. You may pose your questions using the Q&A function found at the bottom of your screen here. Please ask topic-related questions only. As if you would like to ask the same question as other participants, please click on the thumbs up icon to upvote. Breast Cancer Awareness Month, or BCAM, falls on every October. The National BCAM Committee engages the community in various activities to increase awareness of breast cancer. We have public education forums, community outreach and roadshows, the famous Pink Ribbon Walk, and movie in the gardens, etc. COVID-19 may have changed the way we live, but in some positive ways as more Singaporeans have started to exercise regularly. It is indeed a very different Breast Cancer Awareness Month this year. We almost didn't make it due to circuit breaker. Through the hard work and dedication from all partners, coupled with support from kind volunteers and sponsors, we bring to you our virtual BCAM 2020. This year's theme is Time for Breast Health, aims to highlight the importance for women to play an active role in their breast health. Through regular exercise, doing breast self-examinations at home, and going for mammogram screening as recommended. Our first speaker for today is Clinical Associate Professor Veronique Tan. Dr. Tan is a senior consultant and head of breast surgery at the National Cancer Centre Singapore and Singapore General Hospital. Ladies and gentlemen, please welcome Dr. Veronique Tan to unveil the facts of breast cancer for us today. Dr. Tan, please.
Hi. Good morning, everyone. It's really good to see everyone here logged in on a Saturday morning to learn and share more about breast cancer. So thank you for the introduction and great to have everyone here today. So this morning, I will be sharing a little bit about what breast cancer is in Singapore, what the situation is. I will talk about the risk factors for breast cancer, what we can do to prevent breast cancer, why early detection is important and how to do it. And finally, I'll share a little bit about how promotion boards screen for life for breast cancer, and that's our National Health Screening Program and what it entails. So guys, is it better? Is the sound better? Can you hear me now? Is it better? Can you hear me now? Is it better? Is it better to hear? Sorry about that. Is this better now?
Yes. Thank you.
Okay, I'm really sorry for the hiccup. Let's start again. So today I'll share a little bit about breast cancer, unveiling the facts. I'll talk about what breast cancer is and how we can do to protect ourselves from it. So in today's talk, I'll share about the situation of breast cancer here in Singapore. I'll talk about the risk factors for breast cancer, what we can do to reduce our risk, as well as prevent ourselves from getting breast cancer. why early detection is important and how to go about doing that. And I'll share a little bit about Health Promotion Board's Screen for Life, what it entails and how we can all utilize it to stay healthy. So this is data from the Singapore Cancer Registry. It shows us the top 10 cancers in females in Singapore. And we see that the number one cancer is breast cancer. In fact, breast cancer alone makes up nearly 30% of the cancers that we diagnose each year. In another way, about 1 in 13 females in Singapore will get breast cancer. And if we were to just pause here for a while and think about the number of females that we know, we interact with every day on a daily basis, we will realize that we see hundreds and hundreds of females, of which every 13 of them want to get breast cancer before the age of 75. And that's really quite a large number. And this statistic is the highest in Asia. Okay, I'm really sorry. I'm getting a lot of comments that it's too soft. Can you hear me? Is it better now? Jenna, is it better now?
Yes, yes. Okay.
Okay, let's start back at this graph. This looks at the top 10 cancers in Singapore. And across the years, we see that some of the cancers actually are decreasing in trend. Other cancers are rising, but the rate of increase over the years is gradual. But look what is happening with breast cancer. It is rising at a very rapid rate, right? It outstrips every other cancer type among females in Singapore. So this is a very concerning graph. We see that in the 1970s, about 25 per 100,000 females are affected with breast cancer. But currently, that number is 3 times that, at nearly 70 per 100,000 women. Okay. Now, this is another fact that really highlights that breast cancer is an important healthcare problem. What does this show? A lot of times we think that breast cancer is a pretty good cancer because we know so many people who are treated well and who are cured from breast cancer. However, it still remains the number one cause of death among females in Singapore from cancer. Okay, mortality is death, and breast cancer is 17%. It is the leading cause of death for our women. Okay, so it is a significant healthcare problem. We need to pay attention to it. We need to know more about it. And all of us must see how we can contribute to it in terms of research, in terms of increasing knowledge to see how we can tackle this problem here in Singapore. So when we talk about breast cancer, let's take a step back to ask ourselves, what exactly is the human breast form? Right? We know that in females, the breast is an organ that produces milk that allows us to feed our young. Right? This is a picture of the breast taken in cross section, and these lobules are where the milk is produced. The milk is then flows through all these small ducts towards the nipple, and it comes up through the nipple where we feed the babies. And all these milk producing apparatus is then embedded in fat, and it then goes off the chest wall. Right? Ordinarily, the ducts are lined by a single layer of cells, and these cells are usually very organized. And when one cell grows old and dies, a new cell grows and takes its place. However, sometimes these cells develop an ability to grow in a haywire fashion. Right? They overproduce, they grow abnormally, and they don't die, they become immortal. And some of them gain the ability to invade and spread to other parts of the body. And when that happens, and if it happens in the milk ducts, it's called invasive ductal carcinoma. If this happens in the milk lobules, right, the same thing can happen in the milk lobules. It is then called invasive lobular carcinoma. So what causes these cells to grow in a haywire fashion? It really is because of changes in the DNA. Right? DNA is really the command and control center in the cells. But if there's some abnormality in the cell's DNA that causes it to grow out of control, it then develops these cancer characteristics. And what will cause these changes? Some of us have a genetic predisposition to it. That means we are born with the inability to adjust for mutations. Or we have certain genes that put us at increased risk of getting gene mutations. Sometimes we have lifestyle that put us at increased risk of getting cancers. And also, it might be our environment that we live in that puts us at increased risk of cancers. So let's go through perhaps the top 10 most common risk factors and we see if there are any things that we can do about it. Now, one of the most obvious cause, which sometimes we forget, is that the most common cause of breast cancer is simply by being a female, right? If you're a female, your chance of getting breast cancer is 100 times that of a male. That is to say, for every 100 females with breast cancer that I see one male with breast cancer in my clinic. Okay, so simply by being female, your chance of getting breast cancer is just that much higher. The next risk factor is age, right? As we grow older, we have more time to accumulate genetic mutations, and that increases our risk of any cancers, including breast cancer. So as we grow older, by the time we hit age 40, the risk of breast cancer starts to rise quite dramatically. And that rate rises and peaks at about age of 65 here in Singapore, and then it drops thereafter. Okay, so that is to say that women above the age of 40 really should start taking care of themselves and should start looking out for signs and symptoms of trouble and attend and see a doctor's clinic if you find something that worries you. Now, this is Angelina Jolie. We're all very familiar with her. She came out in 2013 to share that she had both her breasts removed because she had a BRCA1 gene. And that really constitutes a very small part of breast cancers, whereby a specific genetic mutation puts an individual at a significantly higher risk of getting breast cancer. Right? So the most common types of cancer of gene are the BRCA1 gene and the BRCA2 gene. But there are other genes that are rarer and they can put you at very high risk of breast cancer too. But fortunately, it makes up only a very small percentage of breast cancers. There are smaller genes, what we call familial breast cancer, which also puts a woman at higher risk. So having one first degree relative with breast cancer, that means having a mother, a daughter, or a sister with breast cancer, approximately doubles your risk of getting breast cancer. But what I want to share really is that having a family member with breast cancer doesn't mean that you will definitely have breast cancer. Having no family member with breast cancer doesn't mean that you are protected from breast cancer. The fact is, of all the breast cancer patients that I see in the clinic, only 15% of them have a family member with breast cancer. 85% of these new breast cancer diagnoses have no family member with breast cancer. Right? So everybody, regardless of a family history, can get breast cancer, may get breast cancer, and therefore we all have to be on the alert. Okay? Very often I hear my patients tell me, but I have no one in the family with breast cancer. How can this be breast cancer? It can. Now, personal history is also important. If a patient has had breast cancer before, she has a higher risk of getting a second breast cancer, a 3 to 4 times increased risk. Sometimes patients will be treated for other tumors earlier on in their lives, for example, Hodgkin's lymphomas or sarcomas, and they may have had irradiation in their teens. These patients are at increased risk of getting breast cancer at the end of the day. And sometimes having a personal history of certain benign breast conditions also puts an individual at increased risk. What does that mean? A lot of times women go for biopsies, they may take out the breast lump, and they're very happy when the doctor shares with them, you have a non-cancerous lump. And then many people then go along their way. But I think it's important to actually recognize what is the specific benign breast condition that they have removed from their breast, because some of them may not be cancer, but it may have an increased risk of cancer in future. Some of them have no increased risk of breast cancer. So I would tell every woman who has ever had a biopsy, please keep a copy of that information. And in the future, should you see another doctor for a breast condition, share that information so that your future breast doctor will know at what risk profile you are in. Now, another risk factor really is lifetime hormone exposure. That means throughout a woman's lifespan, how much estrogen is she exposed to? And estrogen is the female hormone, right? So an early menarche, an early start of having your periods, a late menopause, not having any breaks in estrogen receptor exposure, that means not having children, not having any breastfeeding, all these are risk factors for breast cancer. The use of hormone replacement therapy after the menopause is also an independent risk factor. So this used to be very fashionable because uh, menopause is difficult, right? You get hot flushes, you get mood swings, you get irritable, and there are many side effects of menopause, and these can all be made better by getting more hormones. But we know that using the combined estrogen and progesterone replacement does put women at higher risk. So these days we say, as far as possible, if the side effects of menopause are tolerable, try not to start using hormone replacement therapy. Being overweight is also a risk factor for breast cancer, especially in the postmenopausal women, because after menopause, the ovaries are sort of quiet, and the main source of estrogen really then is in the fat cells. So if you're really overweight, there is a higher chance of getting breast cancer. Low or no physical activity, that means a very sedentary lifestyle, also puts you at higher risk. And Dr. Kylie Low will share a little bit more about this in his talk later. And these are things that we can certainly change. Alcohol is known to increase your risk of breast cancer. In fact, taking 2 to 5 drinks a week increases your risk by 1.5 times. And there are some studies that share that red meat, taking large amounts of it, that is about 5 helpings of red meat a week, might be associated with an increased risk of breast cancer. So I spent the last 10 minutes sharing about all the various risk factors. And it's really difficult to really wrap our heads around and try to remember everything. But some of these risk factors, I think one way to think about it is that there are some risk factors that we cannot change and some risk factors that we can change. And for the risk factors that we cannot change, such as being female, getting older, whether we have children or not, I think these risk factors are important to know so that we sort of know what is our personal risk of getting breast cancer. Right? So if many people in your family have breast cancer, you know you're perhaps at slightly higher risk. Right? If you're getting older, you know you're at higher risk. So know these risk factors so you know what strata or what stratification of risk you are. And the other group of things that you can change, it is important to know what these risk factors are so that you can make lifestyle choices to reduce your personal risk of getting breast cancer. And this is especially important for people who are at original high risk of getting breast cancer. Okay. So to summarize, I think every woman can take less alcohol. Every woman can exercise regularly and maintain a healthy weight, especially in the postmenopausal period. And for women who are after menopause, try to avoid taking hormone replacement therapy as far as possible. For women who are at very high risk, that is, women with genetic risk of breast cancer, sometimes medications like tamoxifen may be appropriate. Sometimes surgery to remove both breasts may be appropriate. But importantly, the take-home message is if you suspect you are at very high risk of getting breast cancer, please see a doctor, right, to adjust, and maybe you are a candidate for genetic testing. Okay, so now that we have heard about all the risk, right, and we are now determined to change our lifestyle, and after today we say we're going to be healthy, take less alcohol, and exercise. The fact remains that despite a very healthy lifestyle, despite doing everything correctly, there is no guarantee and no sure way to prevent breast cancer. And therefore, early detection is very important. There's everything that we can do and take action on reduces our risk, but still there remains a risk, and we must know how to detect it early. Why is it important? Is because early stage breast cancer is more curable, and the treatment for early stage breast cancer is a lot less toxic, right? It's a lot less unpleasant. Early stage cancer may not need chemotherapy, for example, right? And therefore, all these are great incentives to try to detect breast cancer early. And how do we do that? So one way, and we will be sharing a video later, is really to be breast aware, right? Breast self-examination. The point of being breast aware really is to ask women to examine themselves at a regular basis so that they are familiar with their own breasts and they know what is their normal, and they are at higher chance of picking up something that is abnormal, and they can see a doctor at an early stage, right? So it's not so much asking a woman to diagnose a breast cancer, but know your own breast. If something is changed, then see a doctor. So what are the common symptoms to look out for? I think the most common symptom or sign of breast cancer in females is a breast lump, right? And what is a lump? It really is different in different breasts and for different women. Sometimes it's very obvious, it's like a marble in the breast, right? It's a hard lump that you can feel. But other times it's just a vague thickening, right? A hardening that didn't used to be there, right? So for different people, a lump is different. Try to check yourself, know what is your regular breast, and if there is something that is unusual, just have it checked up. Sometimes it is nipple discharge that raises the alarm. You may not always see blood coming out from the nipple, but if you do have some staining on your bra, if you have some blood stains on your pajamas, right, that might be the first sign, and you may want to go and have a breast checkup. You could also have a nipple retraction. That means the nipple could start being drawn inwards, or you could have a nipple rash. Sometimes there's redness on the breast, right? A redness or a warmth or a swelling. This should also cause you to ask you to see a doctor, even if it's not painful. So if it's red and painful, people think it's infection and go and see a doctor. But if it's red and not painful, I do have many patients who don't come forward to seek medical attention because they say it's not painful, right? But it could be something serious. So please see a doctor. And sometimes things like puckering or dimpling or a pulling inwards or a change in the shape of the breast that can happen. Again, see a doctor. And as part of breast examination, stand in front of the mirror, raise your hands up, right? Turn and look at yourself in the mirror. Look at your breasts. See if they are as they have always been. If there's any change, see a doctor. So this is quite a lot of information to take in. I think one main thing that I want to share is that really pain is very uncommon. Pain is not a common sign of cancer. So please look out for other signs. Yeah. Yes, and a clinical breast examination is also relevant. If you feel something that is worrisome, please see a doctor or a nurse, right? A clinical breast examination is an examination by a healthcare professional. They will check you thoroughly, systematically, looking at your skin, your breast, your nipple, and in the armpits. And really, this is complementary to a mammogram, right? Because for those of us who have had mammograms before, we know that the mammogram really just pulls out the breast and it looks at within the breast mound. right? But the other areas of the body, like in the neck region, in the armpits, these are not well seen on mammograms. And if there are abnormalities, a mammogram may not catch it. So what exactly is a mammogram? I'll just share a little bit. It is really an X-ray of the breast. And how is it done? When you come to a mammogram, you will remove your clothing. The breast is then placed between two plastic plates, and the X-ray beam shown, is then passed down. So the breast is squashed in one plane, and it is repeated in another side, right? So there are two images that are taken, and that tries to help us detect any abnormalities like calcifications or distortions that may be suggestive of a breast cancer. For women aged 40 to 50, the recommendation is to have a mammogram once a year. For women aged 51 onwards, right, because the breast is less dense, you can have a mammogram once in maybe about 2 years. Okay. So maybe just we take a break here and just have a show of hands, or rather a poll, to see how many women in the audience here have had a mammogram before. I think you can just enter it on your computer screen. Wow, this is really fantastic. Nearly 80% of the audience here have had a mammogram before. So I think we are speaking to a converted audience. Everybody here knows about the importance of breast health. I really would like to share and try to convince the remaining 22% that a mammogram is useful, and to really consider it. Or maybe the 22% are males, and that's why they haven't had a mammogram before. Yeah. Okay, so let's talk a little bit about mammograms, right? We have a very good national health screening program here in Singapore. It is run by Health Promotion Board. If you look onto Health Hub on the app or online, you will see breast and cervical cancer screening subsidies for women in Singapore. This is fantastic, right? This is really good because the cost of a mammogram for Singapore citizens is $50. That for permanent residents is $75. And our pioneer generation people, it only costs them $25 for a mammogram. And to add to that, Singapore Cancer Society in October and November, and from next year onwards in April and May, they will provide further $25 funding assistance. That is to say that the final cost of a mammogram might be free for pioneers and might just be $25 for Singapore citizens. So that's a really uh, good value for money mammogram. Okay. What are the criteria? You have to be a Singapore citizen, a PR, 40 years and above, must not have symptoms. So this is a screening mammogram. If you have symptoms, please see a breast surgeon or your GP, right? This is for patients, for people without symptoms. You should not be breastfeeding in the last 6 months. Okay. And what happens when you come and have these mammograms done in the polyclinics? Really, the mammogram is done. It is then read by radiologists back in the main hospitals. Most times, if you have a clear mammogram, you will then receive a letter that says, your mammogram is clear, please then attend a screen in a year or two. If, however, you do have an abnormality that is noted on your mammogram, don't panic. Oftentimes, it is not cancer, but it does mean that you need to come for further assessment. Right? You will be given information of the assessment center to contact. Please contact the Cancer Center, Changi Hospital, Tan Tock Seng, or NUH. Get an appointment and come down for assessment. And what does assessment then entail? So you did a basic mammogram. It shows that there might be something abnormal. You come for assessment, and then you get some extra scans. You may get an ultrasound, You get a 3D mammogram and a physical examination if indicated. So they check you more thoroughly. And what then happens is that sometimes after all the extra scans, it's a false alarm, right? They check and then they say, hey, actually everything is fine. Then you breathe a sigh of relief and say, oh, okay, that's great. And then you go home and wait for your mammogram the next year. Sometimes the abnormality is something that may require follow-up imaging. You would then be advised perhaps to come back for a scan either in 6 months or 9 months' time. But for some women, after doing additional scans, you may be recommended to go for a needle biopsy. And let me share what it entails. So this is an example of an ultrasound-guided needle biopsy. And what really happens is that you lie down using an ultrasound. The radiologist then finds where the tumor or the abnormality is. You're given local anesthetic, a needle that goes in and extracts some cells and samples the tissue. And this tissue is then passed to a pathologist to look under the microscope to determine what these cells are. The results are then discussed by your surgeon, your radiologist, and a pathologist. And that is to say, for every one person who comes through the system, there's actually a whole team of doctors back end that are looking and discussing the details of that assessment. And thereafter, you may either get a letter or you may be asked to come down to the clinic and have the details of the treatment presented to you, or results in treatment presented to you. So what I really wanted to share is that really there's a whole team of doctors back end, a whole team of specialists that are taking care of every person that is coming in through this breast screen program. It is an excellent program. Please do make full use of it. Spread the word. Okay, there are some myths that I thought I would like to address here. One of the common things that I always hear from patients and from even my friends are that the mammograms, the polyclinics are not so good. I want to go to the hospital directly. But that's not true. The fact is, the machines in our polyclinics are really top of the line digital machines. And all these images are sent electronically to our radiologists in the main hospital. Each film is read by two expert radiologists, and if there's any discrepancy or disagreement, a third senior radiologist comes and reads and gives an opinion. So this is really, really very high standard mammogram reporting, and our experts are closely audited for volume and accuracy every single year. So this system is excellent. That's another myth to say that, if the mammogram says that there is no cancer, um, it must be right. And unfortunately, that is not true because the mammogram is perhaps only accurate 75-80% of the time, depending on your breast density. So what I'm trying to say is, if you have a mammogram that shows you all clear, but if you still feel a lump, if you still have nipple discharge, or if you still have something on your breast that worries you, please still see a doctor. Don't say that a mammogram was clear, therefore I have no cancer. I can ignore this symptom. Okay, so please don't ignore anything that worries you. And the last thing is, a lot of people say I've had a mammogram once in my life, it was okay, and therefore I don't need another. The truth is, a mammogram is not a protection, it's not an amulet, right? A mammogram just checks at that time point what the condition of the breasts are. Right? And it may change. As we grow older, we may develop cancer. And therefore, it is critical that we do mammograms at regular time intervals. This time is okay, you breathe a sigh of relief, you check again, right, in 1 year or 2 years, and then you check again. So it is this habit that you adopt, right, to try to pick up breast cancer at an early stage. Okay? Okay, so just to test everyone, true or false? Having a mammogram once that is okay means that I won't have breast cancer ever. We entered our answers. Don't worry, there's no marks. Perfect. Right, so the answer is false, right? We do need to have regular rescreens or mammograms at regular intervals. So that is a very important message that I hope that you take home today, right? If you've once had a mammogram and it's normal, remember to have your second, third, and fourth mammograms thereafter. Next question. Detecting breast cancer early is important because less treatment is needed. 2, there is a higher chance of being cured. Or 3, all of the above. Okay, I'm really, really happy. Almost everyone got the correct answer. The truth is, early detection is important because oftentimes it means that the chance of cure is higher. It also means that the amount of treatment or the toxicity of treatment is often much less than detecting breast cancer at a late stage. So for all those who answered all of the above, you're spot on. I'm very happy for that. Yeah. Okay. So there's good news and there's a great incentive to try to detect breast cancer early. Great. Okay, so to sort of close this first session, what are the 8 things that you can do today to reduce your risk of breast cancer, to increase your chance of detecting breast cancer early? Well, 1, we can all reduce our alcohol intake. Right? That is not to say that you cannot take alcohol, but it means perhaps take less. Right? Try to avoid the casual drinking, maybe drink on special occasions. It does reduce your risk of breast cancer. 2, all of us can eat a little bit less red meat, okay? And we can certainly all exercise. Okay, so 150 minutes of exercise, moderate intensity exercise each week has shown to reduce the risk of breast cancer by nearly 10%. Right, so that's really worth doing. We can all avoid being overweight. If we have children, we can decide to breastfeed them. For women who have hit the menopause, the perimenopausal period, and postmenopausal period, if it's possible, try to avoid using hormone replacement therapy. For women aged above 40, start thinking about appropriate screening, start considering going for your mammogram, and certainly start checking your own breast. And if you think you're at high risk of breast cancer, please speak to your doctor for risk assessment. So the take-home messages are breast cancer is very, very common. It is the #1 cancer in Singapore. It is rising, the rate of it is increasing very rapidly, and it still remains the #1 cause of cancer death among females in Singapore. Early diagnosis is important because it makes breast cancer more curable and the treatment that a patient will need is less toxic. Early stage breast cancer is very, very treatable. Breast cancer screening by mammography is able to detect breast cancer at an early stage. Do consult your doctor if you have any breast symptoms that makes you worried. And this is something that I would really, really like everyone to take home. That is to say, the majority of breast cancer is painless. Please don't look out for pain. If there's a lump, if there's nipple discharge, if there's anything that concerns you, don't wait for pain. See a doctor. Okay? Majority of breast cancer is painless. Last question. I will poke a mammogram after this talk. Yes, no, maybe. This is the QR code for you to scan to book a mammogram. Fantastic. That's really good to know that majority would book a mammogram. For those that are considering, it's also great. Hopefully, the other talks would convince you. And if there are any further questions to sort of clarify anything that you might want to know, please type it in the Q&A session, and then we'll have a chat about it later. Okay. So thanks very much. Um, that's all I have for today.
Thank you, Dr. Tan. Ladies and gentlemen, let's sit back
Thanks,
and
back to you.
enjoy. Okay. Thank you, Dr. Tan. Ladies and gentlemen, let's sit back and enjoy a video on breast self-examination. Sorry, please give us a minute.
Oh, it's showtime already? Alamak, I need to prepare. Hello everyone, I am Auntie Sue and I'm joined by all my old pals today. We're gonna share with you more about breast cancer, the most common cancer among women. Can strike anytime one. 1 in 14 women in Singapore will develop breast cancer by 75 years old. So whatever age you are, you do self-check on your breast. Come, let me show all of you on how to DIY self-check for breast cancer. Because I know most of y'all never check. Stand in front of a mirror and follow these 3 easy steps. Look, touch, check. First, put your hands on your hips and look for changes in breast shape. Skin surface and nipple abnormalities. Raise your arms and look for the same changes. Next, touch and feel your breast using your middle 3 fingers, moving in circular motions from the outer area towards the nipple. Gently squeeze your nipple to check for any discharge. Finally, check for lumps by covering your entire breast from your armpit to your cleavage with different pressures. DIY self-check can be done anywhere comfortable and anytime, like in the shower, in front of the mirror, or lying down on your bed. If you don't notice any changes, remember to still check next month, okay? It's always a good practice to do regular self-checks. The best time to do it is 7 to 10 days from the start of your period, when your breasts are least swollen and tender. If you are no longer having periods, then choose a day that's easy to remember lah, like the first or the last day of the month. Your risk of breast cancer increases with age, so do it consistently, okay? Not enough, right? You should also go for regular mammogram screenings. It's important that you go for it, even if you... For ladies aged 50 and older, you should go for mammogram screenings once every 2 years, as it can detect breast lumps before it can be felt ma. Don't be shy to see your doctor early, okay? If you notice a lump or changes in your breasts. Early detection saves lives. Hurry and share this knowledge on self-examination to your family and friends now.
Look, through this video, you will do your monthly breast self-examination and encourage the women around you to join you. Our next speaker is Assistant Professor Celine Ng. Dr. Ng is a consultant in the Division of General Surgery Breast Surgery, Department of Surgery at the National University Hospital. Ladies and gentlemen, please welcome Dr. Celine Ng to share with us on treatment and latest development of breast cancer. Dr. Ng, please.
Hi, morning everyone. I'll just share my slides. Okay, I hope everyone can see clearly. Thank you again for spending your morning with us. In my talk today, I hope to walk you through the different treatments of breast cancer in the hopes that this will help clarify some of the doubts that you have and to also make the process less frightening than it seems. I will also be sharing some newer developments in breast cancer that are all available locally. Before we start, I would like to reiterate that breast cancer is highly treatable. As you already know, breast cancer survival rates in Singapore are very high, and that really is thanks to a good healthcare system, but also thanks to you. When you seek help and are diagnosed at an early stage, this gives us the best opportunity to treat you and also your best chance of cure with minimal interruption to your lives. Breast cancer diagnosed at early stages require just 2 to 6 weeks of active treatment with very good survival rates. All breast cancer patients are cared for by a multidisciplinary team to ensure that all patients' needs are cared for, from disease treatment and prevention of recurrences to psychosocial health and well-being, and even future planning. Every patient has a unique treatment plan, which is essentially tailor-made treatment to suit the patient and his or her needs. The type of breast cancer will help determine the treatment needed for our patients. Breast cancers have hormone receptors and other receptors such as HER2. The most common type of breast cancers are actually hormone receptor positive cancers. These are commonly known as estrogen receptor positive cancer or ER positive cancer. Different medications are available to target all of these receptors and hormone expressions and will determine the treatment plan for our patients. Now, another important factor is the stage of breast cancer. Stage 1, 2, and 3 breast cancers are treated with the aim of cure. Other treatments are added before or after the surgery to decrease the chances of relapse. Stage 4 breast cancers are treated with really the aim of palliation and control. Palliation focuses on providing the patient with a good quality of life, controlling symptoms that may arise due to cancer spread, while systemic treatment is used to control the disease. With more research and new therapies, we have actually seen much better results in survival, even in patients with stage 4 breast cancer. Breast cancer treatment can be broadly divided into local regional therapy as well as systemic therapy. Local regional therapy, on one hand, takes care of the cancer cells within the breast and the armpit or the axilla, while systemic therapy takes care of the rest of the cancer cells in the whole body. Most patients are advised to take a combination of both. Surgery is a common type and a form of local regional therapy, and is really one of the anchors of curative surgery for breast cancer. As breast cancer most commonly spreads to the axillary lymph nodes before spreading to the rest of the organs, curative surgery involves removing the breast cancer within the breast and testing and removing the affected axillary lymph nodes. Depending on your stage, type, and other personal factors, your surgeon may offer you different surgical options. Broadly speaking, there are two main types of surgery, total removal of the breast, as well as breast conserving therapy where only part of the breast is removed. Let us first go through total mastectomy. It's a common word that you might have heard of. It actually consists of removing the affected breast with its skin, including the nipple and the areola. The scar is usually hidden within the bra. Patients who choose this option are fitted with a prosthesis or padding that can be slipped easily into their bra, enabling the patient to look as normal and completely normal, in fact, in her clothes. Some patients choose to have reconstruction of the breast during the cancer operation or even further down the line of recovery. In this case, the skin of the breast and most times the nipple areola complex are preserved and the breast is reconstructed using either implants similar to those used in breast augmentation surgery or tissue flaps from the patient's body. Autologous or flap reconstruction uses tissue transplanted from another part of your body, usually the belly or the back, and a combination of implants and these flap reconstructions can also be done to help the patient achieve symmetry as well as their ideal breast size. Now, in the leftmost picture, I'm not sure if you're seeing my cursor over here, but you can see A shows the mastectomy site. B and C actually shows the rectus abdominis muscle, commonly known to us as the six-pack muscle. And D, the oval section of skin, fat, and muscle that will be used to recreate the breast. In the other pictures, you will see that the back muscle, also known as the latissimus dorsi muscle, is being used to recreate the breast. Though autologous or tissue flaps are durable options for reconstruction with good cosmetic outcomes, as a large muscle is being used to recreate the breast, the patient often experiences some kind of muscle weakness and also risks some hernia formation. Advances in surgery has allowed us to recreate the breast using what we call free flaps that decreases all of these risks. A common example is the deep inferior epigastric perforator or the DIEP flap. Another thing to note is as the nerve endings are actually disrupted during surgery, the reconstructed breast tends to feel a little bit numb. Now nerve fibers can be reattached to combat this and allow some recovery of sensation in the reconstructed breast as well. If we decide that, or if the patient is offered to have breast conserving surgery or wants to keep the breast, this is an alternative to total mastectomy. Breast conserving therapy consists of two components: one, the breast conserving surgery or lumpectomy, and two, radiotherapy. They have to be given together. It has been shown that survival outcomes are comparable with mastectomy or removal of the whole breast, and differences in local recurrence rates are really negligible. Breast conserving surgery or lumpectomy involves removing the cancer with a margin of normal breast tissue. Radiotherapy is administered after healing is complete. As you can see in the photo, this is one of our patients who had a 2 cm tumor in the upper outer quadrant of the breast. and the scar is hidden in the axillary area. She is now 6 months post radiotherapy, and you can see that breast conserving therapy allows selected patients like her a chance of cure while keeping their own breast and feeling as normal as possible. On this note, there's the development of the field of oncoplastic surgery, which has allowed us to offer breast conserving therapy to more and more of our patients, really in the hope of enabling our patients to live healthily and happily. Onco represents cancer, while plastic represents cosmesis. This is a field of surgery that allows us to move the breast tissue and the tissue around the breast to reconstruct the breast after a lumpectomy. The aim really is to recreate a breast for the patient without using implants or tissue from the other parts of the body. Moving on to the second part of surgery is the lymph node part of the surgery. As I mentioned before, we always have to test the lymph nodes. Lymph nodes act as filters for our body's lymphatic drainage system. This is why the lymph nodes are likely to catch or filter out any cancer cells that might be floating in the fluid that sort of drains away from the cancerous area of the breast. Though there are many lymphatic tracts in our body, the breast typically drains to our armpit or axillary lymph nodes. Sentinel lymph nodes are what we call the first or the representative lymph nodes in the axilla. They usually catch any cancer cells that are traveling away from the breast to other parts of the body. Determining if cancer cells are present in these lymph nodes will determine the stage of cancer. Affected lymph nodes can be cleared during the same surgery. To locate the sentinel lymph node, a medical grade blue dye or a radiocolloid marker, which is very safe even in pregnancy, will be injected into the breast prior to surgery. The lymph node or nodes are identified during the surgery and sent for a quick assessment under the microscope. If cancer cells are found, the rest of the lymph nodes are usually removed during the surgery. This is what we call an axillary clearance. Now, it is really best to start by testing the sentinel lymph node if appropriate to avoid side effects from lymph node surgery, such as lymphedema or swelling of the affected limb. A lot of my patients are very fearful of the word surgery. They ask me, can my body tolerate surgery? I'm elderly, I have medical problems, and also they're worried about pain. Breast surgery is actually done under general anesthesia, which means that you'll be asleep and comfortable throughout the procedure. As the breast is technically outside the body, it is not within the body, the stress to the body is actually minimal, and most surgeries are considered minor surgeries with the exception of some types of reconstructive surgery. Usually, our patients experience minimal pain, which is easily controlled by simple analgesia or pain medications such as regular Panadol. Patients generally stay just for one night or even get discharged on the same day, depending on the type of surgery they have undergone. In summary, surgery options are tailored and offered to each patient according to the stage as well as the type of cancer. Pre-existing medical problems have to also be considered to give the patient the best cure with the least risk. Above these medical factors, the patient's lifestyle needs are also taken into consideration in the hopes of enabling our cancer survivors to live a life not limited by their cancer. The second component of local regional therapy is radiotherapy. Radiotherapy is actually given for all patients who undergo breast conserving surgery or lumpectomy and in patients with more advanced stage disease. The commonest type of radiotherapy is what we call external beam radiotherapy. This means that radiation is delivered from a source that's outside the body. If you can see on the right side of my slide, you can see what radiotherapy delivery looks like. On the left side, you can see that this top image actually depicts a special CT scan being done prior to your radiotherapy. This helps us plan out the radiation dose and the area to be radiated. As you can see, the radiation is depicted by the colored lines and boxes, and is really centered on the affected breast and tries to avoid the surrounding organs such as the heart and lungs. It is relatively tolerable with minimal side effects, but requires the patient to come for sessions over a course of 4 to 6 weeks. The recent advancements have helped shorten this to 3 to 4 weeks, that is on Monday to Friday. Sessions are short and most of our patients are able to work while undergoing radiotherapy. There are some side effects of radiotherapy, and a common though hardly dangerous one is hyperpigmentation. In severe cases, some patients can have skin burns akin to those that you get if you stay in the sun for too long. Simple moisturizers and avoidance of sunlight can really help. And as you can see from these photos, the pigmentation tends to lighten with time. Both these patients have undergone breast conserving therapy, and you can see that the patient in the first row, who is 2 weeks post completion of her radiotherapy, has some hyperpigmentation over her left affected breast. While the patient in the bottom row, who is now 6 months out of radiotherapy, you can hardly notice any skin changes to tell you which breast was affected. A newer type of radiotherapy is called accelerated partial breast irradiation, or APBI. In this radiation therapy, radiation is actually delivered from within the breast using special tubes placed within the breast. Again, the colored lines here shows the radiation dose and the radiation area. The radiotherapy is targeted to the area where the original cancer is. It spares the rest of the organs and also the rest of the breast. The good advantage of this is really a short duration of therapy, 3 days compared to 3 to 4 weeks, as well as the opportunity to repeat a lumpectomy or breast conserving surgery if local recurrences should occur. APBI is only used in selected patients at the moment, and it does involve inserting tubes under local anesthesia as well as moderate sedation. The tubes, as you can see, are placed all within the bra line, so this means that the patient can still receive radiotherapy in an outpatient setting. Next, we'll move on to systemic therapy. Systemic therapy aims to sort of treat the cancer cells that is outside the breast and the armpit, okay, to prevent metastasis and spread, as well as the cancer from coming back. It consists of chemotherapy, endocrine therapy, targeted therapy, and sometimes immunotherapy. Systemic therapy can be used before or after the surgery. Prior to surgery, it is used to shrink the tumor, allowing breast conserving surgery. It can also be used to buy time for genetic testing in young patients with breast cancer or in patients with concurrent medical problems such as a recent heart attack, a stroke, or even things like uncontrolled high blood pressure, all of which increases his or her risk for general anesthesia and have to be treated prior to surgery. In specific types of cancer, there is also a proven survival benefit. After surgery, the systemic treatment is used to prevent recurrences. Chemotherapy is a common type of systemic therapy. It enters the bloodstream and reaches most of the cells in our body. Now, the word chemotherapy really tends to spark fear and avoidance in many of our patients, and I hope to assure you today that you are not alone. Chemotherapy is actually part of the treatment for many of our patients. As such, over the years, there has been such vast improvement in both the delivery of chemotherapy as well as the mitigation of side effects of chemotherapy. Majority of patients now receive the chemotherapy in the outpatient setting, and most experience only mild to moderate side effects that do not require hospitalization. A whole range of medications are also available over the counter and with us to counter the side effects of chemotherapy, making the treatment much more tolerable. One of the first questions, my patients commonly ask me when I mention chemotherapy is, will I lose my hair? Though not life-threatening, it really is a valid concern and a big deterrent in our patients' acceptance of chemotherapy. I hope to assure you today that not all chemotherapy causes hair loss, and more importantly, that hair loss is temporal and hair regrowth is almost certain. One of the advancements we have is the use of scalp cooling therapy. A cooling cap, just like a regular cap, is worn prior to and during chemotherapy. The scalp is cool, causing the blood vessels to constrict or narrow, which may limit the amount of chemotherapy drug that reaches the hair follicles. Select patients have actually benefited from prevention of up to 50% of hair loss. And the pictures on the right, this is me as well as our operations staff trying on the cooling cap. I must say it did feel really comfortable, especially because this is sunny Singapore. Despite the new technologies, most patients embrace the new look and make use of scarves and wigs to go about their daily lives. These are some of our breast cancer survivors, and I don't think any of you will disagree with me that they look and really are amazing. Another common question I frequently get is, can I not have chemotherapy? Or I would like to do everything, but I really do not want to have chemotherapy. Now, though chemotherapy has its benefits, its side effects, both physical and psychological, are really not to be ignored. In the past, oncologists relied on calculating risk scores as well as clinical experience to decide on the administration of chemotherapy. This sometimes could result in either over or under treatment. The development of genomic risk scores has made chemotherapy decision-making much more objective. Eligible patients are those who have early breast cancer, they are hormone positive and are going to receive hormone therapy, as well as HER2 negative. In these patients, we can do some special tests. Simply put, the genes of the tumor removed during your surgery are tested in a special laboratory overseas, and a risk score report is provided. If the score is very high, there is significant benefit in adding chemotherapy to the treatment regime that usually already includes hormonal therapy. If the score is low, there may be minimal added benefit, and a patient may be able to safely omit chemotherapy. Moving on to another common type of systemic therapy is endocrine therapy or hormonal therapy. It is usually administered orally in a tablet form. Endocrine or hormonal therapy refers to the use of treatment that suppresses the female hormones in our body. It is offered to all hormone receptor positive patients, and if you recall from the earlier slides, that is the most common type of breast cancer. It helps to decrease recurrence risk and is largely tolerable and affordable, but has to be taken in the long run for 5 to 10 years. These are easily taken with the patient's existing medical medications such as diabetic medications as well as antihypertensives. Common drugs include TEM or tamoxifen as well as letrozole. A newer type of therapy is called targeted therapy, and they really are special drugs that are also part of systemic therapy. In the formation of breast cancer, there are actually many events that lead to a cell becoming cancerous. Targeted therapy aims at targeting these specific events to treat the cancer. A most common example is anti-HER2 therapy. HER2-directed therapy targets the HER2 receptor of the breast cancer, preventing the cancer cell from growing and replicating. It is used only in HER2-positive cancers. The most common drug being Herceptin. Herceptin is one of those drugs that is considered a game changer in the development of modern medicine, as it really helped improve the outcomes of HER2-positive cancer significantly. Now, I'm sure a lot of you have heard of Angelina Jolie, and Veronique has also mentioned her. She was a famous Hollywood actress who also made the news when she shared about her story of having BRCA or BRCA. It is a gene mutation that she inherited from her family and puts her at very high risk of developing certain types of cancer, including breast cancer. PARP inhibitors are a special type of targeted therapy who are used in patients like her to target this specific event that has gone wrong that results in a higher risk of breast cancer. Lastly, we have immunotherapy. Immunotherapy is treatment that uses part of a person's immune system to fight diseases such as cancer. This can be done in a couple of ways, stimulating or trying to boost our own immune system, our natural defenses, so that it works harder as well as smarter to find and attack the cancer cells. It is not yet standard of care for breast cancer, but its use in some specific cancers such as triple-negative breast cancer has been promising. During the breast cancer treatment, the patient might be approached by his or her treating doctor to participate in clinical trials and research. This is beneficial to the patient as it provides access to new therapies that may sometimes not be so readily available. There are very strict guidelines regarding these trials, and this ensures and prioritizes patient care and safety over trial results. As I've shared in my previous slides, many targeted therapies and even new surgical techniques wouldn't have been developed or possible without our brave cancer survivors who have given of themselves to better breast cancer treatment. Now, before I close, I would like to touch on a bit about breast cancer and COVID-19, a topic that is very close to our hearts at the moment. At the back of a lot of our minds, as well as the patients who come, they're asking, is it safe for me to come to the hospital? Will my cancer care be compromised if I come to a hospital or a clinic that is at the front line of COVID-19 care? Should I delay seeing my doctor even though I have a breast lump, even though I have abnormalities, I have nipple discharge? These are all genuine concerns, and I would like to reassure you that hospitals and clinics have taken precautions and measures to ensure that cancer care is maintained during the pandemic. In phase 1, team segregation has helped us minimize contact with other team members and practice social distancing. It ensures that a team of doctors will always be available for patient care at all times. Guidelines and audits have also been published that helps us prioritize patients according to the urgency of their care. This ensures that resources are correctly distributed and allocated, and cancer care is not compromised. On top of this, we have home delivery services of medication and teleconsults. This has helped decrease unnecessary travel to and from the hospital while ensuring patients will continue on their hormone therapy. So in summary, please come to the hospital should you find any suspicious or worrying symptoms, and please do get your mammograms if you are due. To end, I hope to leave you with some take-home messages. Number one, breast cancer is highly treatable even in stage 4. Seeking help and treatment early is the most important, as most breast cancers can even be cured in its early stages. As I said before, breast cancer treatment may seem scary, but there's been so much vast improvements over the years that patients are able to survive well through their fight of breast cancer. Thanks so much for your attention, and I'll be happy to take any questions during the Q&A. Thanks.
Thank you, Dr. Ng. We will now invite our third speaker, Clinical Assistant Professor Kylie Low. Dr. Low is a consultant from the Division of Medical Oncology at the National Cancer Centre, Singapore. Ladies and gentlemen, please welcome Dr. Kylie Low to share with us on exercise and cancer. Dr. Low, please.
Thank you. Let me share my screen. Okay, so I'll be the last speaker and I'll be in between you and lunch. Okay, so hopefully we can end this session well, and as well as some Q&A later. So you had a good couple of talks from Dr. Veronique and Dr. Celine earlier about breast cancer, as well as the treatments that are available for breast cancer patients. So I'll just move on to just talk about exercise and cancer. So for those of you who may not have experienced cancer before, who don't know much about cancer, cancer is a disease of uncontrolled cell growth. And we know that our bodies are built up of cells. So these are the building blocks of our bodies. And sometimes these cells can become rogue. They can grow uncontrollably. They can invade and they can spread to different parts of the body. We know that cancer can start at different parts of the body, and the breast is actually one of the commonest types of breast cancers in Singapore, if not the most common in women in Singapore as well as the world. Now, unfortunately, we do see a rising incidence in cancer, not only in Singapore, but also globally. But as you've heard earlier from Dr. Celine, we are also seeing an increase in survivors from cancer, including breast cancer, because of access to good treatments as well as early detection. Now, we know that cancer being a serious disease, it requires serious treatments, and that includes surgery or combinations of that and chemotherapy, radiotherapy, targeted therapies, and anti-hormone therapies. So we as doctors, we often have to grapple between the benefits of such treatments as well as the risk. Usually when it comes to the opportunity to cure a breast cancer, the benefits often outweigh the risks here, but we mustn't forget and manage the risks well. Now, so often we are focused very much on curing cancer, but sometimes the cost of curing the cancer sort of fades into the background. So I'm talking about the long-term consequences or side effects of the treatments that we give. I'm not saying that every patient will experience these side effects, but this is just a reminder on how we all need to work together to try to reduce the impact of cancer as well as the treatments that we give on our patients. Now, what if we can tip the balance on the side of the patient? What if there was this pill that is still being actively researched, but a large body of preliminary research suggests that it increases survival after cancer, it increases the ability to complete your cancer treatment, it improves your quality of life, it reduces the side effects of your cancer treatment, it reduces the risk of getting a new cancer, and it actually potentially reduces the risk of a breast cancer relapse. Now that would be great, right? Now, unfortunately, this pill is called exercise, and we can't really put exercise in a pill. So my talk today will cover how we can exercise against cancer. Okay, it is possible, and I'm going to unpack the topic here further. Now, what exactly is exercise? So exercise is physical activity that causes an increase in energy expenditure, okay, and is designed to maintain or enhance your health. Okay, that is exercise. Okay, there are different types of exercises. So there is endurance exercise. When you do brisk walking, this so that you have enough endurance and stamina, to climb steps, to dance at a party. Okay, then there's strength training or strength exercise to strengthen your muscles so that you can lift groceries, so that you can age well, you can carry your grandchildren. There's balance exercise, so you can prevent falls and related injuries. Then there's flexibility exercise, so you can drive a car or you can get in and out of a car, you can dress, you can wear your bra. So these are the different types of exercises patients or people can do. Now, just hang on, yeah. What are the benefits of exercise or physical activity? So there are many of them. Okay, we know that it improves cancer survival. It certainly improves cardiovascular or heart health. It improves psyche or the mood of people, physical fitness. It also improves blood sugar control, especially for people with diabetes. It improves your energy levels, sleep, aging. It also improves your sexual health with your partner. And importantly, as I said before, it reduces the risk of getting cancer to start with. Now, we know that exercise reduces the risk of up to 10 cancers. And breast cancer is just one of them, but other common cancers include like womb cancer, large intestine cancer, prostate cancer, as well as lung cancer, and the rest you can see there. So here, exercise, as I said before, I want to emphasize it improves survival, it improves your ability to complete your cancer treatment, your quality of life. It reduces the side effects of cancer treatment, the risk of new cancers, as well as the risk of cancer relapse. Now, Dr. Pernille Holman is an exercise cancer researcher from Copenhagen University Hospital in Denmark. Now, her group actually pioneered sort of the bench research into how exercise impacts cancer in their mice studies. So what they found was really quite remarkable. They saw that when mice that were put in cages that had a running wheel in them, they saw that there was a significant reduction in the cancer growth in these mice. Okay, and when they tried to understand, why was this happening, they realized that this was because the immune system was actually activating. No, this was because the exercise was actually activating the immune system, which is quite remarkable. And so far, there are lots of research or clinical studies that are being done around the world on exercise and cancer. And roughly about 500 studies are actively recruiting patients to study the effects of exercise on cancer worldwide. So this is really a hot topic here. And of course, various leading organizations in cancer around the world essentially just came to a consensus that you should exercise. Exercise has remarkable benefits for cancer survivors as well as people who, in terms of reducing the risk of getting cancers. Now, this is Associate Professor Prue Cormie. She's a famous exercise cancer researcher in Australia. So these are her quotes at a TEDx event in Perth. She said, if the effects of exercise could be encapsulated in a pill, it will be prescribed to every cancer patient worldwide and viewed as a major breakthrough in cancer treatment. If we had a pill called exercise, it would be demanded by cancer patients, prescribed by every cancer specialist, and subsidized by every government. And this is so true. But unfortunately, exercise is not a pill. Now, we'd like to hear your thoughts, through a poll, while we wait for our host to bring up the poll. How much should you exercise in a week to gain its health benefits? Wow, so it shows that most of you were listening to Dr. Veronique's talk earlier. So great, so most of you know the answer. The answer is 150 minutes. Yes, you're absolutely right. Okay, so what do major, so what is the general recommendation for physical activity or exercise from governments and guidelines around the world? So the answer is you should do at least 150 minutes of moderate intensity exercise in bouts of 10 minutes or more each week. Okay. If you are very fit, then you can also achieve that by doing 75 minutes of vigorous exercise across the week, or a mixture of moderate and vigorous. Now, people often ask me, what's the difference in between moderate and vigorous intensity exercise? So moderate intensity exercise is anything that you do that you can still talk, but you can't sing. So if you brisk walk, you try singing to yourself. If you cannot sing and you can still talk, that is moderate intensity exercise for you. For vigorous exercise, means you will find it hard to talk or sing. It is also recommended that people do at least 2 days a week of strength training exercise. So that may be doing some weights, yoga, or even doing household things like carrying, shopping, groceries, and so forth. And thirdly is you need to minimize the amount of time spent being sedentary or sitting or lying down for long periods of time. Now we know that there is a lot of research done into sedentary behavior. So it is defined by any waking behavior, okay, characterized by low energy expenditure while in a sitting or reclining position, especially if it's more than 8 hours a day. It is not synonymous to physical inactivity. It is associated to a higher risk of cancer and cancer death. And there's also a higher risk of dying if you are sedentary a lot of the time. So important message here, do not be sedentary, move as much as you can through the day. So this is an app called Active 10 that was initiated in the UK. Essentially to where the government is promoting walking briskly for 10 minutes actually counts as exercise. So you need to walk briskly to get the benefit. So when I mean briskly, I'm referring to moderate intensity exercise. So you can download the app and you can use it. It is quite useful. I have used it before. Now, exercise we know is good, but you need to do it safely, especially if you have pre-existing medical conditions. And if you do, then you should see a doctor to get a medical clearance. Usually, we would recommend that you start slow and you gradually build up the intensity and the frequency of the exercise. And stop and get yourself checked if you encounter any discomfort like chest pain or breathlessness. If you can, you should get yourself a personal trainer to guide you in your exercise program. Now, despite how good exercise is, there are barriers to exercise, okay? And these are the common barriers that people have described. You know, I have no time, I'm too tired, my kids, my husband, my mother-in-law, I just don't like exercising, I'm just too lazy. So these are very common barriers that I think all of us can relate to. Now, the important thing is you need to believe that exercise is actually good for you. That is the starting premise. You need to believe, especially for cancer patients, that exercise will help reduce the side effects of the treatments, okay? And exercise may reduce the risk or relapse of your cancer. So by knowing these facts, right, it may help you to get across the line and to actually hit the ground running. So how do we overcome the barriers of exercise? So if you're too tired, you should consider exercising when you feel the best. For example, at the start of the day, you can force a commitment. For example, if you can set an exercise date with a friend, okay? So if you've already scheduled a time or a date to meet your friend, generally people would be embarrassed to cancel. You can use a step tracker as well to at least to encourage you towards a goal. I have no time. So you need to reframe your mind. So everyone has no time, but why do some people still manage to get exercise in their busy schedules? So 150 minutes is actually only about 1% of your week. So if you can just reframe your mind to that may make it more palatable. You can break up your exercise to smaller sessions. So for example, you can do a 10-minute brisk walking session during your lunch break in the morning as well as in the evening. And then you're pretty much done 30 minutes in a day and you've only got 5 days to do it. So you can sneak in exercise time in the course of your work or in the course of your day-to-day activities. So when I walk to the MRT station or I walk in the MRT station, I try to walk faster so I can hit that brisk walking pace. And I can include that in my daily exercise goals as well. Kids, family, husband, well, I think you need to work with your spouse to allow you time to exercise. For example, your husband can babysit your kids, or you can even drag the whole family out to exercise together. Or if you're at work where there's no kids, no husband, no mother-in-law, well, you can exercise during your lunch breaks. I don't like it. Well, the question is, how can you make exercise enjoyable and like it? So you can find an exercise game that you enjoy. As an example, this is an image of the Nintendo Ring Fit device, where you use this ring here and you can play a game, and it's actually quite fun. Okay, so you can try to spruce up your exercise activity to make it more fun. Exercising with friends and family is usually more fun, but of course during COVID, this may be a bit difficult, so you may want to exercise with your family. You can also use a step tracker or even apps that you can download from iOS or Google or Android, yeah. Too lazy. Well, it starts with believing, as I said before, that exercise is important and that you are going to change. You need to positive self-talk yourself. Use statements like "let's do it," "focus," "let's go." Exercise with your friends and family to keep yourself accountable. Now, there are many exercise options in Singapore. You can visit the Health Hub page. You can see all these exercise activities that are organized by Health Promotion Board. Of course, we have to stay tuned what happened post-COVID-19. So pre-COVID-19, there was so much happening around Singapore. You can also explore exercise options with Active SG. For example, here you can see that you can join a Masala Bhangra dance workout. But of course, here you have to stay tuned post-COVID-19. Okay. Now, Active SG gyms have now opened. So they are actually really good. They have good exercise equipment, and they also have trainers that actually go to the gyms, and they are very affordable. Now, since September 1st, so outdoor exercise classes overseen by exercise instructors are now allowed as well. So this is from the government. Of course, we know the National Steps Challenge. I've done that before, and I still do my 10,000 plus steps a day. So aiming for a step count is also another good way to motivate yourself to reach a goal. And just a reminder, you can also download the Healthy 365 app, and when you exercise, you get points where you can actually change. You can exchange for vouchers with various merchants around Singapore. Okay, as we come to the end, I have one more poll to get your thoughts before we finish up. After this talk, how likely are you going to engage in more exercise? Wow, I am quite encouraged. Okay, that's still good that the majority of people think it is very likely that they will engage in more exercise. 48%, 29% say likely, and 18% say that I already do enough. Fantastic. Okay, so, oops, I go back. So this is a very common message that people tell themselves when it comes to exercise. I just can't do it. I am too weak. I'm not fit enough. I have no time. I have, I have too many things going against me. So the answer is not I can't do it. The answer is I can do it, but how? Okay. It's always good to start somewhere. You don't have to achieve 150 minutes a week in your very first week. You can just try to do 10 minutes in a day as a start. So always start doing it. Don't not start. So once you start, then you can build on that, and then you can see whether you can, you can build it up to the target range. So the answer is you can do it. Thank you. That's the end.
Thank you, Dr. Loh. And thank you all three speakers today for their valuable sharing this morning. We will now move on to our Q&A session. Dr. Tan, I have a question for you. Dr. Tan, can you hear me? Oh, we can't hear you. Dr. Tan. Oh. Then we'll ask Dr. Celine first.
Yeah, okay.
Okay, Dr. Celine, we have a question for you. The question is, aside from breast self-examination, what tools or diagnostics procedure are available for male clients?
Okay, so firstly, male breast cancer is a thing. It's not common, but if any of the male patients present with any of the signs and symptoms that Dr. Veronique has shared, so such as nipple discharge, a little painful lump under the nipple especially, you should come and see your doctor. They actually present quite similarly as our female patients, except as you know, the male breast is much smaller, so sometimes the signs or the symptoms are more subtle. Please come early, especially if you have a little lump or nipple discharge, like I mentioned, because you have to be treated early. The way that we work out male breast cancer is actually similar to the female breast cancer, and there are no good screening tools, but men can actually also have mammograms. Another thing we use is also an ultrasound. If there's a lump or any suspicious nodules, we do use a biopsy as well. There is no screening for males now, but patients who have a family history such as that, like similar to Angelina Jolie, with a strong family history of breast cancer, other males in their family having breast cancer, many young breast cancer patients in their family should seek their doctor for consultation, and then we can talk about your risk and possibly genetic testing. Although male breast cancer is not common, it still exists. And so if you are male, don't be shy. I think some of my patients have mentioned that they have come a little bit later because they feel uncomfortable going to a clinic where they're meeting women. Don't be. Bring a friend with you, bring even your mom with you, or any your girlfriend, your wife, your daughter, it's fine. And then we can go for the consult together and it won't feel awkward.
Okay, thank you, Dr. Ng. Okay, back to you, Dr. Tan.
Let's try. Can you hear me now?
Yes, I can hear you now. Thank you. Okay, this
Okay.
question is for you. If mammogram is only covering X-ray on breast specifically, would ultrasound scan be more comprehensive as it can scan other parts of the areas, such as armpits or close to breast area?
Okay, so that's a very good question because it actually shows that the, the person asking the question understands that the mammogram only looks at the breast. And the thing about breast cancer screening is that you're trying to pick up breast cancer at a very early stage, right? And you're trying to pick up changes so early that there are not signs that it hasn't spread to the lymph nodes, etc. Right? And therefore, for a person without any symptoms, the mammogram to look specifically at the breast to find changes that hasn't even developed into a lump, that really is the best test. for breast cancer screening. Of course, if there are any lumps that a woman feels as part of the health checks, then an ultrasound is used to double check and to assess and to look more deeply into that concern. Okay?
Thank you,
Celine.
Dr. Tan.
Yeah, Dr. Celine, there's a question for you. I'm 59 years old. 2 years ago, I had diagnosed with ductal carcinoma in situ, high nuclear grade. I had lumpectomy done on my right breast, followed by radiotherapy and letrozole pill daily. Recently, biopsy showed that my right breast has high-grade ductal carcinoma in situ. Can I have another lumpectomy or must I go for mastectomy?
Okay, so maybe I can summarize this patient's sort of story. So she had stage 0 breast cancer. That's great. It's picked up very early, and she had successful treatment with a lumpectomy, means removing part of the breast, and then she subsequently underwent radiotherapy that we mentioned to protect the rest of the breast. On top of that, rightly so, she was given systemic therapy, which is hormone therapy, to try and decrease the risk of recurrences. Because radiotherapy was already given to that breast, which is the right side, and there's new cancer cells or abnormal cells that will eventually become cancer in the same breast, we don't recommend repeat radiotherapy on the same breast. Why? Because one of the side effects or risks of radiotherapy, besides scarring to the hearts and the lung, is really risk of a second cancer due to radiotherapy or the radiation itself. In this case, if she received conventional radiotherapy, means radiotherapy from outside shining to the whole breast, then she would need a mastectomy. Like I mentioned before, there are reconstructive techniques now, and so even if she does do so, she can have a recreated breast that will help her feel as normal as possible. If she actually underwent what we call the abbreviated or the celebrated partial breast irradiation, so only part of the breast had been shined with the radiotherapy, the rest of the breast was spared, then she may be able to have a repeat lumpectomy and a radiotherapy. So I think it's important to know that there are so many options to suit the patient's needs. So if having a breast is of concern for her and make her feel like a much happier patient after that, then there are reconstructive techniques. So it's important for her to discuss this with her doctor.
Thank you, Dr. Celine. Dr. Tan, there's a question for you. Is calcium calcification of breast at high risk of contacting breast cancer? Dr. Tan?
So calcifications are oftentimes the first clue that there is something going on in that area of the breast, right? And it does not necessarily mean that it is equivalent to cancer. Calcifications can be caused by cancer, but a lot of times it is also caused by very benign changes, a little bit of scarring in the breast as we grow older. There are calcium deposits and fibrocystic change and all that. So it's not the calcium that turns into cancer. It is more a manifestation of the presence of cancer cells in that area that results in calcium forming, and therefore the mammogram is done to try to pick up areas of cancer by looking at calcification. Does it make sense? Does that adequately answer the question?
Thank you, Dr. Tan. Hi, Dr. Kylie. There's a question for you.
Yeah.
Is HER2 breast cancer same as BRCA cancer?
No, it is different. So HER2 positive breast cancer is one of the three types of breast cancers where it is driven by a genetic problem within the cancer cell that makes the cancer cell grow fast and spread through a protein called HER2. Whereas BRCA mutation positive cancer or breast cancer is where there is a mutation within the normal cells of the woman that predisposes that woman to getting cancer, breast cancer, ovarian cancer earlier in life. So it's quite different. So BRCA mutation cancers, depending on which type. So let's say if it's BRCA1, many of the BRCA1 breast cancers are triple negative breast cancers, as opposed to BRCA2, where many of them are hormone-driven breast cancers. Yep, done. Yep.
Thank you.
Okay, so I don't know. Hi, thank you, Dr. Kylie. We have another question. I'm not too sure who we should address this to. I'll just read out the question. I underwent breast microscopy in 2019 because lines fibroedema displaying pericanicular, sorry, please pardon me, and intracallicular growth patterns was detected. Diagnosis, no evidence of malignancy. I postponed my follow-up mammogram appointment for early 2020 because of COVID-19. To be on the safe side, do I need to have the mammogram done immediately? Being a 70-year-old senior, I'm equally concerned about visiting hospitals unnecessarily because of the virus. Your advice is appreciated. Thank you.
Okay, maybe I'll answer that. So I'm very happy for Madam Wee, right, that the biopsy showed just a hyalinized fibroadenoma, and that is a benign lump that does not have an increased risk of breast cancer. So really, she just needs to go for a regular mammogram screening. If it was due in the earlier part of the year and then all screening was paused because of COVID, she does not need to go for an urgent rescreen if she doesn't have any new symptoms. She can wait for the pandemic to settle a little bit and go at an appropriate time when she's more comfortable. Because really, I think breast cancer screening for age 70, 2 years is the recommended duration. But I would suggest continuing to get breast self-examination and regular checks just to make sure that any symptoms, should they develop, is picked up early. Right. So no, there's no immediate need to rush down to get a mammogram now. But when the time is good and it's just comfortable, things have settled down a bit, then please continue to have mammogram screening. I think the good thing is that the situation for COVID seems to be quite under control here in Singapore. Touch wood, I shouldn't jinx it, but it seems to be okay. So all our breast screening facilities have resumed. Please do consider going for breast screening about this time now. Right? And our hospitals, polyclinics, general GP clinics are also safe. Certainly, a lot of steps have been put in place for infection control. So don't be too scared. Okay.
Thank you, Dr. Tan. Thank you, everyone, for your active participation. Thank you, Dr. Tan, Dr. Ng, and Dr. Loh. Okay. To recap today's forum, we hope you bring with you these 3 key messages: examine, educate, and exercise. Singapore Cancer Society is providing $25 mammogram funding assistance at more than 50 participating breast screening centers. You may take a screenshot of this page, save it in your gallery, and scan the QR code for more information and list of participating centers. Join our virtual public forum and learn about the trends of breast cancer, risk factors, signs and symptoms, screening and diagnosis conducted in 4 languages. You may take a screenshot of this page again, save it in your gallery, and feel free to register anytime. NCCS is organizing a series of Get Fit in Pink online fitness class this October. You may take a screenshot of this page, save it in your gallery, and feel free to register for these free virtual classes.
Oh, we're finished.
Sorry, we'll be playing this Pink Plank Challenge to support our Breast Cancer Awareness Month.
Oh.
Please help us to improve by completing the feedback form. The link will appear immediately after the webinar ends. We have come to the end of the webinar. We would like to thank our three speakers, Dr. Veronique Tan, Dr. Celine Ng, Dr. Kylie Low, and especially everyone here for spending your Saturday morning with us. We look forward to your participation in our future events. Thank you, everyone, and have a great weekend. Take care and stay safe.
There's still a lot of questions.